Hi everyone, Scott here from BetterHealthGuy.com. Thanks for joining me for another Better Health Guy blogcast. Today's topic is Pondering Parasites. First, I want to say that everything in this discussion is for informational purposes only. No comments are intended to diagnose, treat, or cure any condition. Additionally, nothing in today's talk is intended to serve as medical advice or information to facilitate self-treatment. As always, please discuss any potential health-related decisions with your own personal medical authority. Today we have Dr. Raphael, a holistic medical doctor providing consultative services in the area of natural health. Dr. D'Angelo has over 45 years in medical microbiology and parasitology and conducts research on various aspects of infectious disease. He is certified in family medicine, integrative holistic medicine, medical microcurrent, clinical aromatherapy, and medical technology. Dr. D'Angelo has conducted research in natural treatments of infections with current investigations in parasite eradication. His testing has personally been helpful to me as I've done it a couple of times and also gone through his treatment protocol. In my experience in dealing with Lyme disease and chronic health issues, parasites are an often overlooked but critically important area to explore. Welcome to the show, Dr. D'Angelo.
Well, thank you, Scott. Glad to be here.
Yeah, I appreciate it very much. So what drew you to the field of parasitology, and how did you end up doing the kind of work that you're doing today?
Well, I can thank the Air Force for that. Way back when I graduated from high school, I didn't know what to do with myself. I ended up being drafted during the Vietnam War and wound up in an Air Force uniform and then eventually in a medical technology training program. And this program was a year, actually a little longer than a year. And my first assignment was Vietnam. And there at the big hospital encampment, I was running the microbiology lab, did a lot of the parasitology work, and that just got this little guy excited about doing some real important diagnostic work. So after that year, I came back to the States, got my undergraduate education, went into medical school, and thought I would be a pathologist, which would be the natural progression for microbiology work. But I ended up being a family physician because I really love working with people. But I always kept a lab on the side and tried to do my own tests when time and circumstances would permit it. So that's how I got involved in it and have basically kept it going ever since.
It's interesting how your interest in parasitology and microbiology came out of your military background. And another one of the people that I followed in the realm of parasites is Dr. Simon Yu, and a lot of his interest in parasitology also came out of the military. So that's an interesting connection there. So maybe you can share with us a little bit about what are parasites and what are the differences between protozoan parasites and the kind of larger parasites that we think of as worms. Is one of those or the other more of an issue from a health perspective, and how are they classified?
Well, that's certainly a question with a broad set of answers. I could start out by saying that a parasite would be relative to what it does when it enters the human body. If it is going to feed off of our nutrients and then acquire some aspect of reproductive activity and make more of themselves, this certainly could qualify as a parasite, especially if it starts to interfere with any of our own biologic processes. So I would say that, to some extent, certain bacteria, certain viruses, and certain parasitic organisms would all qualify there. As far as the types of parasites, we have protozoas are your one-celled organisms, which are microscopic. You can't see them in the stool with the naked eye. And these are very numerous in types and numbers, worldwide in distribution, and usually found in water, lakes, streams, rivers, and sometimes carried by animals and pets. And then you have your larger organisms, multicellular, which would be your worms. There's a whole variety of those and different flukes, which can inhabit different parts of the body. So these are kind of, in a general way, the types of parasites that we're normally dealing with.
So, for people listening, the protozoan parasites, those are things like Giardia, Cryptosporidium, Toxoplasmosis, as I understand. How do we. You mentioned a little bit on the protozoan and the exposure to water, but how do we generally get exposed to parasites? And I know there's kind of an understanding that people have that if you haven't left the United States, you probably don't have parasites. But can you talk to us about some of the common ways that we get exposed to parasites? And can that occur if we've not left the United States?
Well, it is certainly a myth that because we live here in this country, we are, for some great reason, not exposed, but we are exposed. And let's kind of take let's take Cryptosporidium and Giardia as examples. These are pretty bad dudes. When we get them, they're going to cause havoc within the intestinal tract. We're usually going to have episodic diarrhea, and it may be self-limited, or it may go on until it's diagnosed and treated. This organism, it is inhabited it inhabits water, it inhabits ice up in the Rocky Mountains. The wild animals have this in their intestinal tract and excrete it with their excrement. It runs off in the rains, becomes frozen in snow, and eventually melts and comes down into the resourced water that we draw from for human use. The filtration process is pretty good at keeping it from being in any quantity running down to the tap in our kitchen. But saying that, they still can get in, and in susceptible people, they're going to pick it up. So protozoa are worldwide. They're virtually found in every part of the globe, and many different animal models and birds can carry this. So we are exposed just by living on planet Earth. And I think that's really the misnomer, is that somehow in our country we have such great public health activity that we are not going to be exposed. But we are exposed, but maybe not as much as in, say, a third world country.
Yes, very interesting. So, I've even heard that some people have looked at salad bars, for example, in one of the larger cities in the United States and found evidence of parasite eggs in something like a salad bar, even. So, it sounds like people definitely do get exposed to these things.
Yes, they do. And speaking of the restaurants as a possible source, they did a study in Los Angeles where they went through restaurants and they took fingernail scrapings from workers. And the result was that there was fecal material under some of the workers' fingers. So, we are unfortunately exposed even in our own good country here.
Yeah, I heard someone refer to fingernails once as parasite shovels. How important is it to wash fruits and vegetables and other things that we purchase and bring into the home? Is that a source of potential parasites as well, or is that not such a significant consideration?
I think it is significant. There was a time several years ago when I was picking up a particular protozoan parasite we don't normally see much of, and it was recurring over and over. It turned out that it came in on cilantro from a particular field in Mexico. CDC was tracking the diarrhea episodes that people were having in with this outbreak. Just an example of things that we buy normally could harbor parasites. I think we should wash our vegetables. I tell patients to draw up a sink of water, put your vegetables in there to soak, and add about a half a cup of white vinegar, and just let the acidic element get in and around your veggies. Then after a few, 15 minutes or so, rinse them off and put them up. I think we also can possibly be in contact with I think just because it comes in and has been washed doesn't necessarily mean that it's totally clean. So we should wash our meats before we use them. So I think that's important too.
Yes, and it's interesting, and I won't mention the store, but a friend of mine not too long ago had purchased some fish from a very well-known chain store, cooked it, and when they cut into the fish, there were clearly 3 worms in the fish, and when they took it back to the store manager said it was not an uncommon thing. So I don't think people expect to go buy fish from the store and see large parasites, but it sounds like it does happen.
It does happen. That's true.
What are some of the common symptoms that people might experience with parasites? Are there asymptomatic carriers of parasites, and do we generally see symptom improvement when people implement parasite treatments?
Well, I think first of all, you can have no symptoms and have parasites. This does come to my attention once in a while, but many people will have symptoms such as bloating, excess gas. Um, with protozoa, there may be weight loss. There also is often intestinal distress of one kind or another, such as constipation problems, diarrheal episodes, smelly stool. There can be certainly symptoms that are associated with excess yeast, because I also look for that in the stool sample. Sometimes that may be associated with rashes and can cause diarrhea and constipation on its own right. So some forms of GI distress of one kind or another. I might also add that when people go to their doctor with GI complaints and things are looked at, they may run a parasite test and find nothing. And so they get a diagnosis of irritable bowel syndrome, and maybe you're on management medications. But I find that people with irritable bowel syndrome almost always have protozoa, and almost always in that group have something called blastocystis hominis, which is a particular type of protozoan parasite. So the symptoms vary depending on how long they've been there and the nature of where they're doing most of their damage, if you will. If there are upper symptoms, that could be something like giardia, which likes the upper part of the intestinal tract. Roundworms tend to want to be in the upper part and not in the colon, actually. So it depends on where they are and how many and what they're trying to do to stay alive in there.
Okay, very interesting. Would you say that protozoa, or larger parasites, of the two, which one is generally more of a health concern, or are they pretty equal in terms of the potential health problems they create?
I think they're pretty equal. I mean, if you take the worm family, because of their size and the nature of the tube that we call our intestinal tract, if you get a bunch of those in there, you could actually have an intestinal obstruction or semi-obstruction. Or in the case of the roundworm ascaris, it tends to want to curl up near where the pancreas and the bile ducts empty into the intestinal tract. So sometimes people can have symptoms of pancreatic trouble or even gallbladder issues that might be due to a worm sitting where all these liquids are supposed to go into the intestinal tract. The protozoans, I see most of the time I see protozoans, and occasionally I see worms, but the protozoans themselves, uh, they can cause inflammation, irritation. They also there can be enough of them to where just sitting on the surface of the absorptive surfaces of the intestinal tract, they may inhibit some of the absorption of our nutrients, medications, supplements, and they also like to eat our good bacteria. So with that in mind, what the CDC calls a non-pathogen, in my mind, I don't quite agree with that. So I think that some of these organisms that are dismissed as they're always there and don't worry about them, I think that's a bit of a problem in some people.
Absolutely, very interesting. If you had to estimate, what percentage of the population might you suspect has a parasite?
Well, from those that seek my services, I would say 95 to 98% have parasite of one type or another.
So, in your testing, then, when someone sends in a first sample, is it 90 to 95% of the time that you do find evidence of some kind of a parasite?
Yes, it is. And if on one of those rare occasions I can't find anything, I then send out some more sample vials for more collection of stool. And I'd like at least three negatives before I write it off as a negative test.
Okay, very good. Is the reason maybe we don't see as many worms in the testing, is it that the worms are just not as common, or maybe just not as readily excreted in the stool?
Well, I think that it can be both of those issues. Um, they are somewhat common, more so than most people would think here in this country. The worms are they're either in the soil or in animal feces, basically, and they are deposited into soil. Um, the animals that we slaughter for meat can certainly have some worms that then get in and around the meat. Now, these are going to be washed off, but we're talking about microscopic eggs here too that could kind of get into a sliver of meat or something along that line. You mentioned fish that had worms. Those are usually flatworms, which we call tapeworms, and fish tapeworms are pretty common. They aren't going to be washed off when you bring your fish home. They're inside the meat itself.
Hmm.
Yeah, it's a mix, but I'd say that most of the time it's protozoa, and some of the time, maybe 20-30% of the time, we have evidence of some type of roundworm or maybe a tapeworm.
Yeah, and I've seen lots of those videos online where people have sushi and can actually see the worm moving through the sushi. It's pretty frightening. So it seems there's a lot of tests out there for parasites, but they don't seem to find very much. Why is it so difficult to get an accurate test for parasites, and what is unique about your way of testing that finds what others seem to not be seeing?
Well, I've certainly worked in and with labs most of my life, and back in the 1980s, the government wanted to uh, ratchet down their payments to labs, especially in the Medicare arena. So they came up with something called the Clinical Laboratory Improvement Act. We call it CLIA for short. And this was designed to tighten up some of the rules and regulations for the labs. But what ended up happening is that testing was now, um, the, the reimbursements were cut. They were cut to the point where a lot of the labs were letting good people go, the high paid technicians and technologists. So this was to keep the doors open because this happened across the board for all lab tests. And parasitism testing was hit hard also. So what ended up happening is we lost good people. We brought in what we call laboratory assistants to do some of the manual labor work in the labs. And so one of the reasons why we don't get the positives that I think we should is that they are being done somewhat by not as well trained personnel, number one. The second is our perception of what should be going on here in this country. The doctors believe we don't have parasite problems. The technologists that run the tests don't believe we have parasite problems. And why is that? Because they never get positives. So it's a reinforcing myth that we don't have a problem. So what ends up happening is that the technologist is looking through the scope. He's got 20 of these microscope parasite tests to do. He's got an hour to do it, and then he's got to get on to other things. And so he's not spending time looking at the whole slide. He can't. He's going to look at a number of fields of that slide, and if he doesn't see anything, it's negative, and he goes on to the next one. So the time and the fact that he's not expecting ever to see anything anyway makes him prejudiced a bit in not giving it a full look. And I think that's where I differ from the labs. I'm basically retired from clinical practice, and my hobby, if you will, is spending all the time looking at the whole slide and figuring this out. And then if I don't really think I'm seeing what I should, let me make another slide and stain it and look at it under the microscope too. So I'm just finding things because I'm spending all the time looking for them. The other thing is that there are lookalikes under the scope, things that, well, is that really a parasite, or is that something that kind of looks like it, but it isn't? And I think if you don't really know the difference from experience, you may just be looking at parasites and thinking that they're just waste material. They're just waste material. You say, how can that happen? Well, it can happen. The pictures in the textbooks are beautiful photographic pictures, but when you do these tests, they don't always come out as perfectly clear and textbook-like appearance. You have to kind of know what you're really looking at. So I think it's a combination of the due diligence because they don't expect to find anything, and if they do, it's the whole lab gets up and wants to look under the microscope, because they never see it.
Well, I've heard stories of some people that have even sent in known parasites and they had worms in the sample, and then maybe in the process of preparing the slide or something that was too large and got pushed off to the side, and the lab still did not identify parasites even when there was visual indication of parasites. Do you think this happens in some cases as well?
I think sure. I think it does happen in some cases. When the way I do my testing is the way I did it back in the 1960s when I was in Vietnam. We had a very beautiful parasite lab, but it was very basic. But we took the time to make sure that when you have your specimen and you process your specimen, that you know where in the specimen to get samples from for, let's say, the eggs of worms. It's not going to be the same place where you get the protozoans. Protozoans they're very light, and when you centrifuge a specimen, they will be at the top. And the heavier ones, the worms and their eggs, are going to be way at the bottom. So you have to know where you're sampling from to put on your slide so that you don't miss something. And I think that's important too.
When you identify worms in a sample, is it generally that you're seeing the actual worm, or are you seeing the worm eggs most commonly?
Occasionally, I find the whole worm in the sample itself, and that's when we get the sample, we're looking through it to see if there's any large structures that we can identify with the naked eye. But most of the time with the worms, they're going to have eggs. And we find the egg, and then we can say that, there's an egg-producing worm somewhere up in the gut.
Okay. I've heard some people suggest that heavy metals may be a reason that parasites are kind of allowed into the body, and that the parasites may concentrate some of these heavy metals to make them less problematic for the rest of the body. This kind of leads me to the question, are there certain reasons that one person is more likely to become a long-term host for parasites than another? Do you see any correlation between people with conditions like Lyme or mold illness having more parasites as compared to someone that's generally healthy?
Well, I think the question goes back to the immune system. When we have heavy metal toxicity, the immune system is probably the one organ in our body that takes the biggest hit. And consequently, when the immune system has been hit, it's just not able to deal effectively with infectious agents, including Lyme, parasites, yeast, viruses. People get chronically ill and suffer accordingly. So I really do think that when the immune system has taken a hit, parasite problems are certainly right on the heels of that. Uh, but at the same time, we have to look at the fact that probably all of us have some degree of heavy metal toxicity just living the type of life we have in the world today with all of the chemical constituents that we're exposed to in the air, our water, and in our food. I know we try to minimize it, but over the years, we've accumulated some degree of that. So I think if you're going to have a person who's chronically ill with parasites or any other infectious agent, you got to deal with the heavy metal aspect of it too. I think that's important.
And speaking of the immune system, we know so much of the immune system comes from the gut. What role do parasites play in terms of creating leaky gut?
I think they're a pretty big problem. The the real issue here is their waste products for the most part. All organisms they bring in their nutrients and they excrete their wastes. And depending on the amount of waste and where it's located, if it's in, let's say, the small intestine where we absorb our food, those cells can become irritated and maybe dislodged a little bit, and it leaves crevices between cells for things to get in that shouldn't be getting in. And I think leaky gut is certainly associated with the protozoans, especially the ones that tend to invade tissue. Um, I think the Giardia, the Cryptosporidium, Blastocystis, to some extent Dientamoeba fragilis, these are organisms that are not good buddies to be on top of our absorptive villi cells in the small intestine.
Yes, very, very good. Your test is the only one I've seen that looks at both stool and urine. What do you find in, we talked a little about what you find in the stool, but why are we looking into the urine, and what are we finding in the urine relative to parasites?
Okay, very good question. And when I first set up my testing, I really wanted to catch the rare parasite that causes bladder cancer. And that's a schistosoma organism. Now, we don't have that really here in our rivers and lakes, but we have a lot of people coming over from areas where that type of parasite is endemic. And it tends to live and harbor and grow in the bladder, and it excretes eggs. So I'm basically looking for the eggs of the organism that would indicate that we have a problem there in the bladder. Occasionally, and this is interesting, the pinworm, which comes out, it lives way over in the cecum, and it makes its way across and down and lays its eggs outside the rectal area, then goes back in. These eggs hatch and normally go back in also, but occasionally they get wiped or pushed up into the urethral opening, and then they wind up sitting in the urethra or the bladder. So I've actually had cases where I found the pinworms that were in the colon, but it was in the urine sample,
Wow.
all things. And then I had one lady, she was constantly having recurrent urinary tract infections. And I was doing her stool test, and when I went and started looking at the urine, she had the same protozoa in her urine that she had in the stool. And so we treated for that, and her urine infections disappeared. So basically, her urine infection was a parasitic infection.
Wow, very interesting. I've heard that some people that have dealt with interstitial cystitis also have evidence of protozoan organisms as a factor in that condition as well.
I think it's certainly possible. That certainly is.
So once the samples arrive at your office, what's the process through which they're examined, and how do you then go about identifying parasites in those samples?
Okay. Well, what I first do is open the sample and look through it to see if there's any visible worm material. Then it is taken and it is added to a particular test tube that then is added some reagents that extract the waste products of the stool. The whole stool is not all just waste. I mean, there's cellular material, food cells, digested food cells, and other things. We try to get all of the waste products off by centrifuging or spinning, if you will, the sample mixed with special chemicals. And then those are poured off. And now we have a little button at the bottom of this test tube from which we extract from different levels of it for the heavier, middle, and light parasites. Put those on a slide, and those are then allowed to dry, are stained through a various precise staining process. And then those are dried and now ready for microscopic exam. Meanwhile, if we see that in the history given to us by the person that they are having diarrhea, we also take samples of that stool and we run tests for Giardia and Cryptosporidium by looking for their chemical signature on the proteins. It's kind of like the old pregnancy test where you put a drop of urine and a little bar says it's positive or negative. We can do a similar type of test, but it's looking for Giardia or Cryptosporidium or both. So we do that type of test for those that have complaint of diarrhea. And then I look at the specimens under the microscope. We also then spin down and centrifuge the urine sample, and we take a couple of drops of that and look at that under the microscope, see if there's any parasite activity or excess, or yeast for that matter. I'll report yeast as well. And so that's what we do. And then when I have the data from the exam, I write it up and provide it then. If a person has a doctor and is working with a doctor, I send the doctor the report. If some doctors want the patient to also get it at the same time, I send it to the patient as well. And in those cases where the person does not have a physician or practitioner they're working with, I send it directly to the patient and with recommendations how they might want to treat it.
Very, very complex and an interesting process. And the thing I like about your testing is that it definitely seems to find things very consistently, where I've known people for years that have explored parasites and have had many negative tests and then do your testing and do identify something. So I think it's very useful from that perspective, and I appreciate having it available as a resource. What are some of the more common or most common parasites that you see when you look at client samples?
Well, going by the names of these parasites in the protozoal category, I find a lot of Blastocystis hominis. That is a very common worldwide, almost endemic, wherever you go, type of parasite. And recently there was a book published about this particular organism, and it reviewed 100 years of research on this parasite. They came up with two more forms of how it can look under the microscope, which, knowing now what else you can look for, I'd say that instead of 70% of samples having it, now 90% of samples have it. So by looking for all the different forms of it, I think most of us have it. It's not an easy one to get rid of either, I might add. So blastocyst is a very common one. I do see a lot of cryptosporidium and some giardia. Those are also pretty common. Then you're going to find organisms that, according to CDC, are non-pathogens, but as I explained, they may be causing problems in a given person, and those are going to be Endolimex nana, Iotamoeba bucci, Entamoeba coli, Entamoeba hartmanni. These are going to be the basic ones that I usually find in some, to some extent, not all of them, but some people have one or two, maybe three of them. Then in the worm family, I would say that the most common worm I find is the large roundworm, by its egg. I don't normally see the whole worm. And that's Ascaris lumbricoides, a very common worm. In the adult, the female's about 8 inches long and the male's about 5 inches long, and they look just like fishing worms.
Wow.
Yeah. So that's what I normally see. Occasionally, I see the egg of a tapeworm, and occasionally I may see the egg of a hookworm. They're not as common, but they are certainly can be seen. So,
very, very interesting. What are your thoughts on natural treatments versus pharmaceuticals? Are there cases where pharmaceutical options really are required, or do we think natural treatments seem to cover the majority of parasite infestations? And what are some of your favorite pharmaceutical and natural antiparasitics?
well, in the pharmaceutical category, um, we have some good pharmaceuticals, no question about that. And this is mainly because the problem is a worldwide problem. It's not just for a few people here in the United States, and drug companies that they want to put out a drug that covers many, many different bases, so to speak, many different problems. So we have albendazole, which is a very common one for worms. Some people are using a drug called ivermectin. Um, there's quite a number of them out there. The real problem, as I saw it when I was in practice, was when we prescribe those, they are a little on the toxic side, and some people don't feel so good when they're on them, which can lend it to not being able to use it long enough to really get them clear. That's one of the problems with the drugs, is it's limited by how long you can use them. And in some cases, just a few doses and the worm problem is pretty much gone. With the protozoans, the most common drug used is something called metronidazole. Flagyl is one of the trade names. And it's used for 7 to 10 days in varying doses, but again, there is some resistance to that particular drug over the years, and so it's not 100% effective. And what would end up happening is we use whatever drug is appropriate, and then 6 months later, they're back in with another round of it and having problems. So that kind of led me to want to look at some alternatives, and the alternatives generally are herbal in nature, although I will say that silver in some forms can be very helpful on occasion. But the essential oil family is probably your most concentrated, chemically diverse type of natural product. And the people that have the most experience with this are uh, those in Australia, the United Kingdom, Israel, and Germany, where they're really more into a wide field of types of treatments. So in working with some of the practitioners over there, I was able to understand more about how we could use the essential oils, in a program of treatment for various types of parasites. And that's what I use when I'm asked to help someone out. And so the other aspect that kind of fascinated me when talking with practitioners overseas is they would emphasize that you need to treat according to the cycle of the moon. And this is pretty foreign to our docs here. Some of my colleagues, when they heard me talk about this, would just kind of shake their head and turn away. But in fact, what we find is that as the moon goes from its little sliver of new moon to a full moon, you have increasing work on water on the world in the world. Tides tend to swell more, and we find that parasites, especially protozoa, which are 99% water, they start to swell up as well. And when an organism swells, it increases its metabolism and it takes in more nutrients. And so one can actually use a lower dose of a drug or a natural product during the time as the moon becomes full, and you get the same results. And during the time when the moon is not out, there is some sense of dormancy to the parasite population. They're not as aggressive as you would see during the phase of the moon. So I time my moon cycle from when the moon is half full through the full moon till the moon is half gone. That's about a 20-day cycle, and that's when I uh, effectively use the majority of the types of remedies that I put together and use for them.
Awesome. Very good information. Any thoughts on Alinea? Is that a helpful drug in the world of parasites in your experience?
Yes, it is. I think it is.
Okay.
Uh, I know a number of doctors who like to treat, from what I find, a lot of them do use Alinea.
Uh-huh. And when you mentioned finding yeast in the samples, is that generally Candida or Candida or other types of yeast that you see in the stool sample?
Well, Candida or Candida it's kind of a multifactorial type of organism. It can be dormant or it can be aggressive. And we don't necessarily know when we see it which type it is. So consequently, when I see excess yeast in the stool, excuse me, I will recommend that we do something to get it down to a more of a normal level. I think that's important, and that's what I try to do. Um, Candida in the stool can look just like budding yeast, or it can have long tentacles. It just depends on uh, where it came from in the colon and what it's doing up there at that particular time.
Perfect. In the past, when I thought of the moon cycle, I generally thought of that as more impacting the worms, but it sounds like it does also impact protozoa. So when we think of parasites, it sounds like the moon cycle has an effect both on larger and smaller parasites from what you're saying. Is that correct?
That is correct.
Okay, very interesting. I know that a lot of the substances that you use, we've talked about the herbs and the essential oils, and you have a very methodical protocol around the timing of the moon cycle for several months. Any other comments that you might want to share around how you approach treatment and then some of the substances that are part of your more common protocols?
Um, what I do is when I see that we have protozoa I find that it's helpful to hit it from two different angles. So one angle, I like to use a colloidal silver if I can. Uh, Not everybody wants to be on it, and that's fine. If that's the case, I will recommend maybe an iodine preparation for them. But I'd like to try to use a very low dose of colloidal silver and also a formula for the protozoa that will have a number of essential oils in there that have known action on the protozoan family. Now, just to give you some examples of oils that have action on not only protozoa and worms, but also maybe bacteria and yeast, your oregano, your Thymus vulgaris, there's a chemotype called thymol that's very good. Your clove bud, which has a compound called eugenol, is very good. Cinnamon bark is another one that has cinnamon aldehyde, which is antiparasitic. Then basil. Basil it has a chemotype called linalool, and the linalool is very helpful. And tea tree. Tea tree is pretty common out there in the public eye, but actually it does have action not only on parasites, but also helps to boost immunoglobulin A, which is one of the immune system substances that's one of your first lines of defense in the gut. So those are some of the types of oils that we might find in the treatment of these organisms, the protozoa. With the worms, I find that you really have to hit them pretty hard. They're multi-celled, number one. Number two, they have a skin around them, and you really have to kind of get them agitated and taking in a lot more of what we are trying to give them. So I find that the treatment of the protozoa will also work somewhat on the worms, but around the time of the full moon, when the worm is most agitated, I'll usually come in with another formula that has a little higher dose of your oregano and some of the others I mentioned. And we do that for 3 days right around the full moon. So the combination of the protozoan treatment and the specific worm treatment tends to get them, take care of them. Give you an example. I had a lady that had intestinal distress for 7 years, went to multiple doctors, never could find out what the problem was, but her massage therapist, who knew me, tuned into her GI problem, said, go get a test from Dr. D'Angelo. We did it. She had ascaris. And on the second month of her treatment, she passed a dead roundworm that was black. Normally they come out kind of orange, orangey red. It was black, it was dead, and it was 5 inches long, so I figured it was a male. The next day, she passed 20 or 30 small roundworms. And I said to the technician, the massage therapist, I said, you have really done her a great service here, because I think she was getting ready to be obstructed. She had so much worm tissue that came out. Yeah, I think that's what I do. I hit it hard from different angles, and that seems to clear them out most of the time.
Excellent. So in your testing, we know that there's a very high percentage of finding some type of parasite. But I'm also wondering, in general, with parasite testing, is it also beneficial to do the specimen capture around the full moon to potentially increase the positive findings, or do we think that isn't so critical?
It hasn't been critical in my experience.
Okay, very good.
I really don't feel that's necessary.
So you have a very methodical protocol. I mentioned earlier that I've been through it as well and plan to do some retesting again soon. What percentage of people would you say get a clean test result after going through your 3 month or so protocol? I know we mentioned Giardia, Cryptosporidium, Blastocystis, and some of the others can be pretty treatment resistant. So, how frequently does the protocol seem to clear these things out?
I would say it's about 80-85% that we get them clean. Um, the others, there are various reasons. It may be that it was difficult for the person to cooperate with the regimen. That might be one issue. Another is that sometimes, like onion layers, we peel off that first layer or round of parasites, and a whole different group is now showing up from our clean out. So yeah, about 85%, and then of the other 15%, I'd say another 2 or 3 months of treatment, and we get most of those clear. And there's always a rare person here and there that just can't get cleared up, and we have to look for, is the pet, does their pets have it? Are they working with animals on the farm and constantly around a risk of getting more parasites? I mean, there's a lot of issues that we have to delve into to try to
Hmm.
see why they can't get clear.
And that was actually part of my next question around pets, which you covered, but also around other family members. So, if someone in the family has a significant parasite issue and they're treating that, how critical is it that the other people in the family are also getting treated as well?
Well, I think I've done families all together, and I found that usually the symptomatic person is the one that has the problem. And then, of say 4 or 5 people, maybe one or two others have a little bit, and then there'll be one or two that are clear. So it's been my experience, though, that if you have toddlers, kids in daycare or toddlers, they could often be the carrier in the family, even though they may not themselves have diarrhea or issues that would bring them to the doctor's attention.
Hmm.
So I tell folks, it's possible you could pass these things around, but with normal hygiene, washing your hands, um, you know, changing your clothes and underwear and all that stuff periodically, I don't think it's that much of an issue.
What about those with intimate contact? Are these things potentially transmitted between people sexually?
It's potential, but again, unless there's anal contact or fecal material contact, it's usually not a problem.
Okay, very good.
It's usually not.
What about treatment in children with parasites? Can they also do a lot of these same types of treatment that you just shared with us?
Well, it depends on can they swallow a capsule? Because they're going to put their formulas into capsules. Because these essential oils can certainly cause a good irritation of the throat or esophagus should they just go down without any not being in a capsule. So I make sure people can swallow the capsule. With the children, most of them can't handle capsules. So in that setting, I usually do use a course of some silver, a liquid silver. They can generally handle that without a problem. And I have a liquid formula that I put together that is not essential oils, but herbals. It'll have, things like it'll have black walnut hull and artemisinin and some other things that in liquid form, and they can put drops of that in water or juice for the child. So we are able to cover the little ones that can't swallow the ones that the older children and adults can swallow.
Excellent. So, in people dealing with Lyme disease, it's often common to see a red blood cell parasite called Babesia. And since you're an expert with parasites, I'm interested in any of your thoughts on Babesia and do the essential oil and herbal protocols, silver, and so on, do these also seem to work when the parasite is outside of the gastrointestinal tract and more in either the bloodstream or other parts of the body?
I would have to say yes, because these are, of course, in the gut and then absorbed and do go into the bloodstream. Um, you know, your Lyme organism is constantly changing its coat, so to speak. It's trying to hide, get into cells, and Babesia, same thing. We find that if you do use some silver, and also one of the things that I do use is something called aromatab. Aromatab we put together from what we were putting into capsules for patients. My wife and I would make capsules at night for the next day's round of patients. And it was a specific formula that seemed to cover a lot of infectious agents. Well, we were fortunate to find a pharmacy that could take that liquid oil formula and put it into tablet form. And that was in 2008. Since that time, we did have a time where we tested it in the clinical setting and found that people with Lyme, Babesia, Epstein-Barr virus, herpes, many different kinds of organisms that cause trouble, that this helped them. So if a person has Babesia, one of the things they might consider is having their doctor um, look at aromatab as a possibility. It's made by a compounding pharmacy, and I can certainly give you information at some point on how a doctor could find that from the pharmacy.
Very
But
good.
yes, that would be something that they could look at.
I have personally used aromatab and liked it. It smells like a nice pizza.
It's the oregano.
Yeah, it's very nice. So, do you think that it's useful for people to think about just doing an annual parasite cleanse as a matter of kind of a health practice? And should we be tested and treated on some regular basis? I know we do ongoing treatment for parasites in animals, but what about in humans?
Well, I think if you've had parasites at one point, you probably are doing yourself a favor to get tested annually. If you're clear, you're clear. But if you're picked up something, well, then a lot of times it won't take a lot of effort to get it clear again. So I think, yes, we ought to think, you know, proactively about this and be looking at it periodically. I tell folks, if you come down with GI symptoms, we'll get tested at that point. Once you've been clear and then you get symptoms. But if you're okay, then maybe in a year and a half, you ought to think about another test.
Okay, very good advice. What about the role of either Rife devices, zappers, or other types of machines that work with frequencies to help get rid of parasites? Do these actually seem to work?
Well, I think they work, and I have certainly used them with some patients. Uh, I didn't use Rife's technology, I used a frequency specific microcurrent. But I would say this, that although I could certainly get their symptoms way down, when tested, they weren't really clear yet.
Okay.
So I think they can certainly be an adjunct, but I'm not going to count on them to get you totally parasite free.
Makes sense. So, what can we do to minimize our exposure to parasites?
Well, I think the first thing is take stock of your surroundings and where you get your water. Is it coming from the tap? Um, talk to the people that actually work with the water treatment plant. Find out how they do their backflow. When periodically they got to clean the gunk out of the filter system. When they do that, some raw water is going to come downstream. So it might be nice to know what their procedures are to minimize exposure there. Secondly, be smart with your pets. People have all kinds of different animals now in their homes. it would be nice for them to check with maybe one of the veterinary schools in their area to see what should they be thinking about, what kinds of organisms do these normally harbor, and how could I stay away from getting them is the real question. With dogs and cats, of course, if they're outdoors and then indoors and then back outdoors, they're in contact with the soil. They're also it may be drinking from water that's raw water sitting in a puddle. Also, they lick their anal areas as part of their cleansing process. Then they come in and kiss you all over the face. So you really have to be smart about these things and understand that where the risks are and try to minimize them. With our food, you need to cleanse the food. We talked about some using vinegar water and for our produce and rinsing off and washing our hands afterward when we handle meat. So these are the ways that I think of. Then, of course, of things that we can take in, we can certainly, when people get clear, they ask me, how do I stay clear? We have a product we call ImmuGuard, which is just a little trace of it on the tongue once or twice a day. That seems to be helpful. A drop of iodine in water maybe 3 or 4 times a week would be helpful. I don't really like people being on silver, but if that's what they can do, then maybe once a week would be sufficient to kind of keep things clear. And then there are a host of other, herbals out there that we could certainly take. So I think there's things that we could do to try to minimize catching parasites.
Excellent. And what about the role of diet? Are there certain foods that either increase our chances of getting exposure to parasites, or are there certain foods that we should increase in our diet to shore up our defenses against parasites?
Well, I think that when we eat certain foods, they can kind of increase the chances of killing bad bacteria, virus, and parasites. And that would be the onions, the garlic, things that are known kind of natural antibiotic foods, if you will. Fresh basil is good. It has some essential oils in it that we use actually in some of our formulas, as a matter of fact. But really, I don't find that the diet per se is a biggie, with one exception, and that is if we have excess yeast, we really have to be smart about lowering our carbohydrate intake, the types of sugars, be it natural or not, they need to be lowered because these yeast, that's what they're looking for, and they're going to continue to grow and grow, and they're not good for us. So we got to have a low level of yeast in our gut.
Does supplemental hydrochloric acid have any ability to help minimize parasites taking hold, and is that worth exploring?
Absolutely. If a person knows that they are low in their gut, their stomach acid, that is important. Stomach acid is the first line of defense against parasites because whatever we take in goes in the stomach, sits there for a little bit, and can be neutralized right at that level.
Yes, that makes a lot of sense. Are there any things that parasites do in the body that are actually good for us? I see specific types of gastrointestinal or autoimmune issues now where people are exploring taking certain parasites to modulate the immune response. When are they potentially good, if ever?
Well, I think that's really more of a population study as opposed to general principles. People overseas, when I was in Vietnam, we would do stool tests on some of the women that would come on the base and do laundry and clean and do things like that. They still wanted them to have a stool test. And I would find that they'd have the eggs of 3 or 4 worms, and they'd have 2 or 3 protozoa. And I just say, what is this? But they were perfectly healthy. So I think what ends up happening is we are so clean here in this country from the day we are born that we cannot harbor a whole bunch of different parasites and go on and do whatever we need to do without problems. We're just not equipped. So in this country, I think the real issue here is that I forgot your question. I got off on thinking about the Vietnam situation.
Yeah, no problem. It was, when are parasites potentially good for us, or are they ever potentially good for us?
Yeah. Getting back to USA, I've seen some studies where people take whipworm, Trichoris trichuria. This particular organism seems to modulate the IgE part of the immune system, so it tends to calm down the allergic response a little bit, and that may be well and good. I don't have any experience with that either. When I was in practice offering it, it really wasn't something they did in those days. And I haven't seen anyone come in who's been on them.
Okay.
So I really can't comment, but I can say that there's some experimentation going on right now with that.
Very good. I hear lots of people talking about something called the ropeworm and question if it's a parasite, a biofilm community, something that the lymphatic system is potentially shedding, or something else. I don't think anyone really knows, so do you have any thoughts or experience on the topic of the ropeworm?
Well, I was never trained on ropeworm, number one. This is something that came accidentally into my practice. I occasionally get patients that send me pictures and want to see if I can identify some type of parasite based on a picture they've taken and sent to me. I saw one that looked like a big fuzzy worm. It was a huge thing, and I really couldn't grasp what I was looking at. So I told the person I didn't know. And then a few months later, another person sent me another picture that had a similar look. And I thought, what is going on here? And they mentioned, is this ropeworm? I thought, well, I better learn about ropeworm. So I did some work on the internet and found that there's a Russian that's described them. And there's a doctor in Tampa, Florida, who's also kind of corroborated on trying to figure out what these are. And they feel that it's actual biological material based on sections that they've taken through some of this stuff, but we don't have any DNA on it yet that I know of. And then there's kind of pictures that show stepwise what happens, and it sure looks like it's more mucus and biofilm than it is anything else, at least in the beginning. So we have no knowledge of where it comes from or its life cycle, or that it even makes any eggs or reproduces or anything. So all we can say is ropeworm is a phenomenon that has kind of shown up here and there in various folks. I had one lady who went through my program. She had protozoans and ascaris. She was on my program. She said that it did not get rid of her ropeworm. I'm assuming that she knew what she was talking about. And then she got on something called Mimosa baduca.
Yep.
And this is a South American herb, and said that that was working. That actually was helping her. So I've kept that in mind in case I find someone else with a ropeworm. I'm going to suggest that they get on that Mimosa product and see what happens.
Good to know. I've worked with people that have used mimosa and felt that it was helpful with many different types of parasites, so thanks for those comments. What are the most important things that you do in support of your own health on a regular basis?
Uh, well, that's a great question. I do take a handful of supplements. I am a type 2 diabetic, so I have to be real careful with diet, exercise, and drinking plenty of water. Got to stay well hydrated. And that would be something I would pass on to anybody. You've got to be well hydrated. That's the start of health right there. I mean, if you're breathing, great. But then next thing is you got to be well hydrated. And then from there, um, you really have to take stock and listen to your body. Don't minimize things if things are beginning to happen on a regular basis. Figure out what it is, get the best advice, and then do your research and find out what are my options and what are the alternatives. I mean, that's really how to take care of your health, and that's really what I do. I have a doctor, and I run things by her, and she is very open to natural approaches if they will work. And so I have to do my research and let her know that I'm going to try something, and she's with me, and then we'll see if it works. And so it's nice to have that kind of rapport with somebody who can kind of keep you in line and doing the right thing.
And I'm assuming that you get tested for parasites on a regular basis.
I did at the very beginning, and I didn't have any, and I had yeast.
Oh, wow.
I had some yeast because of the diabetes, I think. But
Very
I
good.
did get blood tested by a doc here in Florida a number of years ago, and he's the one that diagnosed the diabetes.
Mm,
Um, I had not done a blood test, and of course, doctors sometimes don't take care of themselves, and I was in that boat at that time. So he did a finger prick. He says, "Oh, your glucose is 300 and something." I said,
wow.
"What?" So, but he also did a live blood cell, and he was blown away because I had no parasite activity whatsoever. And he says, "What are you doing?" And I said, "Well, I pulled out of my pocket the ImmuGuard that I take a drop of 2 or 3 times a day." He says, "Well, keep doing it because it must be working." So,
Excellent. Excellent.
yeah.
So, where can people find you and how can they access your testing and some of the products and things that you've talked about, like the ImmuGuard? Is that something that's readily available? Do they need to get that ordered through their doctor? How can they reach out to you?
Well, first of all, we'll talk about testing, getting tested. I have a website where all of the information is there and available, and one can order a test. It's www. And it's called Para Wellness Research, spelled out PARAWELLNESS research.com. On that site, one can order a test. And when one has been tested, you can order a retest also on that site. Then, as far as the remedies are concerned, these remedies are not just out there for anybody to call up and get. I only use them if they're indicated. And if they're working with a doc, we go with the doctor's protocol. If they want to use one or more of the remedies, we provide those. So
Excellent.
that's how they would learn about the remedies.
Very, very good. Thank you. Yeah, I appreciate you taking the time today to share information with me and with the people listening to this show. Again, I found your testing helpful. I do plan to do some retesting. I just finished one of Dr. D'Angelo's protocols a couple of months ago. I think this is a critically important area for people to explore, and unfortunately, there aren't a lot of good parasite testing options out there. So I encourage people to take a look at parawellnessresearch.com to explore the information that's available there. And thank you, Dr. D'Angelo, for all that you do to make this available to us.
Well, it's been my pleasure, Scott, and thank you for what you do.
Thanks so much.